Now, Africa's vaccine production is set to receive a boost through the African Vaccine Manufacturing Accelerator, which is a new $1 billion financing mechanism designed by GAVI, the Global Vaccine Alliance. Launched in France, the program aims to help the continent produce 60% of the vaccines it needs by 2040. Grace Korea-Kanja explains.
GAVI says vaccine production in Africa provides a mere 1% of the continent's demand. That's right, just 1%. Now, this includes the malaria vaccine, a disease which plagues Africa the most. The COVID-19 pandemic exposed how dire the situation is. African countries didn't have enough vaccines despite initiatives like COVAX, which sought to ensure global equitable access. But Moderna opposed efforts to build a vaccine plant in Kenya this year, citing a decline in demand. It's not all doom and gloom, though. South Africa's Biovac Institute produces and distributes vaccines. In Senegal, the Institut Pasteur is renowned for its yellow fever vaccine production. And Egypt has Vaxera, which also produces various jabs. And now in Kenya, the World Bank is backing vaccine production plans through a $1 billion investment. Now, on a larger scale, Vaccine Alliance GAVI seeks to strengthen Africa's health sovereignty. 8 priority vaccines have been selected to receive higher subsidies, and they include oral cholera, malaria, measles, rubella, hexavalent, yellow fever, pneumococcal, Ebola, and rotavirus. Funding for these will come from unspent COVID-19 balances. $1.8 billion was left over from COVAX. But the African Vaccine Manufacturing Accelerator launch meant for Africa is taking place miles away in France. This has caused a stir. Amref Health Africa says hosting the launch on African soil would signify the continent's ownership and leadership in the initiative. The Africa Centers for Disease Control and Prevention, for its part, underscores the importance of respectful partnership and collaboration, while GAVI says France has been its donor since 2004 and is the second largest contributor to the International Finance Facility for Immunization.
Angelique Coetzee joins us now from Johannesburg. She's a medical clinician and a former chairperson with the South African Medical Association. Good to have you back with us, Angelique. The COVID-19 pandemic shone a light on the unequal global distribution of vaccines as wealthy countries, which are home to big pharma firms, snapped up most of the doses, leaving Africa far behind. So how hopeful are you that this new accelerator will help bridge that vaccine divide?
Well, I'm very hopeful that it could happen because if we look at the stats of the 2019 pandemic, Africa with 1.3 billion people, where less than 30% of people have received vaccines, while the global average was around about 70%. So that's the one thing that it actually highlighted for us, the inequality of these vaccine distributions and the problem in Africa. So your vaccine preventable diseases is reported that, during the 2018, there was a publication that said that more than 500,000 children die from vaccine preventative diseases yearly in Africa. And also approximately 1 out of 5 children in Africa do not receive all the necessary and basic vaccines. So if we look at that, we can see there's a huge problem on vaccines, and the diseases that is most commonly encountered and that is vaccine preventable is your chickenpox, your diphthery, hepatitis A and B, papillomavirus, mumps, measles, and then other like your polio, pneumococcal, and Haemophilus influenza and tetanus. So, this is all preventable diseases. And so unfortunately, Africa will import more vaccines into Africa than around about 99% of vaccinations for all these diseases are imported, and about 95% of our medications are also imported, and that's a problem.
Can I interrupt you there? Because we know the new scheme aims to move vaccine production to Africa to give the continent more sovereignty and to avoid this vaccine inequity from worsening. Do you believe that will work, though? Because the scheme still relies on these big Western pharmaceutical companies ceding rights in order to produce their patented vaccines in Africa.
Yes, you're absolutely correct. I think what people also need to understand, yes, we will still depend on this 1 billion donation, or there's strict rules around that. That is also something that people must understand. There's US 1 billion available over 10 years to help with this, and this AVMA launch was recently held, although the negotiations already started in 2021. So yes, money is always a problem. So that is great to get at least some money, but vaccine distribution and inequalities is much more than only the manufacturing of the vaccines. So we also need to understand that the healthcare personnel must be trained for this. There's vaccine hesitancy across the country or across Africa and in other parts of the world. That needs to be addressed. We need to make sure that all governments are on board with this, that there should be enough infrastructure. So you can put up your manufacturer, but if you don't have the right people employed, there's no electricity, lack of electricity, or water, lack of water, then what then? So it's much more than only a site or a manufacturing site being developed and some money given. It is much bigger than that.
Okay, Angelique Coetzee, we'll leave it there for now, but it's great to get your expertise as always. Thank you.
Thank you so much.